So we're moving away from a little bit from medicine and cardiac death to money. So I think some people should be happy. If you were sleeping, you can wake up now. We're
We are
about.
happy, we are awake, very much awake.
All right. So I work in cardio care hospital as an interventional cardiologist. I also run 3 hospitals in Abuja, and I chair the FCT chapter of the Guild of Medical Directors here in Abuja. And um, yeah, essentially, Medical College of Nigeria, an MBA, and other management. Mainly, I'm talking to you from my management background, not from the physician background. So, Limi Hospitals, where I work, was founded in 1982. So, about 43 years this year. Rebranded in 2015, 3 hospitals, over 420 staff, over 70 doctors. Stanford Sea Transformation Program certificate and multiple awards. We thank God for that. So I appreciate Limi Hospital. Those are some of our hospitals. So why should we talk about medicine and business? There are several reasons why. I know some people, when they hear business and they hear doctor, they cringe. They cringe that why should you combine business and doctor? The reason is that medicine is about providing value, providing life for people. And business is about making that value sustainable. So it is quite common to see high-end services not being available in sectors, public sectors that may not be able to harness business well, because it's not about just providing the infrastructure, it's about making it sustainable. And that's what business is about. It's not about making profit at any expense. And throughout, and in this lecture, for the next 30 minutes, you should learn that. So what is value? Whatever is considered and perceived by a client to be important enough for them to make a trade. That's just simply. If somebody is willing to live longer, that is value you're offering them. If somebody is willing to have the less risk of stroke, that is value. Somebody is willing to have less chest pain by putting a stent in. If somebody is willing to have that, that is value. And that is essentially what business and medicine is all about. Why else do we talk about that? We realize that sustainability and initiation of value production has more to do with business, whether it's even non-profit or for profit. In the organizations we run, we devote 10% of our procedures in terms of interventional cardiology and cardiac surgeries for non-profit. And so whether you're going to do that for profit or not for profit, the most important thing is that the aspect of business is about sustaining, providing that value. And so doctors, even in the FCT, we're beginning to match our clinical education, our research information with business education, because that will make sure that it's sustainable. In this season of Japa, for those that will stay behind to help Nigeria, it's important that we are able to combine all of these things together. So that's why we talk of. Now, number three, why we talk about business and medicine is that doctors have to take on several responsibilities in leadership, business, managerial roles, and it's quite important that you're able to delineate and use both abilities very well. So you're a good cardiologist, you're a good ENT surgeon, but how can you transmit and make sure that everybody gets that value and gets it sustainably? And most times, people that criticize doctors being at the head of the health team always harp on the fact that a lot of times medical training may be deficient in management, that being a doctor does not necessarily equip people for that, and that a lot of doctors in top management positions have not performed very well, despite being very, renowned in their fields. And so this is why it's sometimes quite important, and I applaud NMA FCT and the CME chair for bringing this up. Very important. So another reason why is that government cannot, and really government should not employ everyone. We see that everywhere where healthcare has improved, business has been the bane of it. Singapore, India, and all of that. As the population is rising fast, for the government to deal with all the political issues or not, there is a need for doctors and healthcare workers to rise up to the challenge to provide that. And then, business also brings about competition, which improves efficiency, brings about differentiation, which improves innovation. And this is very, very important. And also innovation is driven by business. And so doctors must have some knowledge about business. When they do so, they are better equipped to help the organizations. They are better able to help those patients that come in and say, I have no money, but the patient is dying. So when you have a better knowledge of business, you'll be able to structure the organizations better to be able to serve our people much, much better. And that, I think, is what we need in the contemporary era of very rapidly changing economic policies. So what is business? So what is business? After saying all of this now, let's not talk about business. And we're talking about business in medicine for those that are just joining us. So business is essentially creating value or extracting value. So as a doctor, we're about translating our inventions, our research into products and services. So now we found a way to take care of sickle cell disease for our patients, 10 of them, 100 of them, 1,000 of them. We have done all the invention research, we have put this thing together, a fantastic algorithm. How then do we translate that to everybody in a way that is sustained over time? That is what business is all about. So it's about the capacity and willingness to develop, organize, and manage a venture. Nothing is without risk. And so it is to manage it, navigate the risks, and make a profit. And I'll talk about later why profit is important, even for not for profit. Profit is very important. I'll give you maybe almost 8 or 10 reasons why profit is important. So there is what we call a value conversion cycle. A value conversion cycle. And I define the values of conversion cycle as the way we are able to create and communicate value, deliver that value consistently, and capture the value in terms of profits. And so what does that mean? First, how do we create the value? We've had an invention, an intervention, we've had a new way of doing things. People with heart attacks don't have to enter a plane and travel before they get there, they die. So now we have to create that value, create a system. Now we have to deliver that value. Most doctors only stay on delivering the value. That is, how can we deliver efficient care, quality care, and all of that? But if that is alone, it will not sustain itself. So it must be able to capture the cost of delivering that service. There must be revenues that match those costs and that are higher than those costs so that it can take care of other contingencies and continue this cycle. Any part of this cycle that is broken will mean that that value will no longer be given. So we've heard of hospitals that have started bone marrow transplants, and then after 3 months, we heard the program has ended. Started surgical programs, and then it has ended. Started even missionary programs, and it has ended. And the reason is because maybe they only focus on operations. Let us take care of these patients, and forgot about profits or forgot about a cohesive strategy. This lecture is not about strategy, so I will not talk about strategy because that will take a lot of time. Now, anytime you are giving value and you are not making profits, it is programmed apoptosis or programmed failure. It means that it's just a matter of time. You will not be able to continue that service. And that is simple. The cath lab will break down one day. You will need to upgrade your software one day. You will need to employ more people. Doctors will need more money instead of going abroad. And so if there's not enough profit to sustain that service, regimes will change and dollar will triple. So if there's not enough, that is just apoptosis on a countdown timer. Okay, so anytime you're giving value, profits must be there. Anytime you're making profit and people are not getting value, that is fraud, and that is really criminal. So if there's excessive profits or profits without the patients and the community as a whole getting value, we consider that as fraud. Now, if you get value and you're making profits and you don't have a strategy, that is luck. And you know the funny thing about luck? Luck always runs out. It always runs out. So it's very important to take all three in your stride when you are trying to deliver a value. Professor Oji, my very senior colleague, just talked about sudden cardiac death prevention. And so a lot of interventions, community health-wise have been done. So how can we put this in this way, in a strategic way, deliver it operationally, and make sure that there's finances to make sure that this thing continues running? That is the value conversion cycle. And if you don't hear anything about it, this is essentially what business is all about. creating, sustaining value for the better good of others. Whenever people are not getting good, it is not business. People must be getting value and getting input. So when a team, an individual, a doctor, identifies a societal need, then acquires and deploys resources necessary for its fulfillment, we're talking about business. And then it delivers it in a unique way and a sustainable way to realize goodwill and profits. So anytime profits are realized without goodwill, it is not business. It must have profits, it must have goodwill, it must solve a societal need, it must harness resources from a team, and bring about uniqueness. And this is what business is all about. So sometimes people mistake. That's why business has a bad rap, and people mistake all of this for that. So business is about managing ideas, value, risk, and resources to solve societal needs. It is not about making money. I repeat, business is not about making money. So doctors should relax and then see, how can I translate this? Profit and money are different things, and you make profits because people are getting, you are solving a societal need, you are managing ideas, you are managing risk, you are managing resources. And that is what we are called to do, even as doctors as well. So it could be internal or external. And what do I mean by that? You could be in an established institution, maybe a public institution or a private institution, and you could begin to offer certain kinds of services to solve a societal need for the profit of the entire organization. So that is an internal form. So you don't have to have started your own before you are running a business. You could be working in another business, in another institution, and establish and bringing about a new way, developing a pacemaker clinic, developing a sleep clinic, as somebody just talked about. That is an internal way. And so far you are giving a value, people are paying for it, and it's profitable and sustainable, then we are talking about a business. And it could be external, either in form of a partnership, collaboration, people come together, or individuals starting something. Now, there are three dimensions of business. We look at first, operational, which is the most common, but it is the lowest form. That is the way where people are focused on just delivering service. It is the most common, but it's still the lowest form of that, because once the service provider dies, goes away, falls ill, that ends that cycle. Then there's tactical, when people are coming together to be able to bring and put tactics to provide. It is not long term, it's medium term, it's short term, but it does provide a framework for translating operational services into some more sustainable. And then strategic, where there's a long term approach to harness everything in our environment and then to deliver that value for the long term. So that's essentially the three dimensions of business. So where do we put ourselves? Most of us, I want to see whether we are still here. Where do we put ourselves? Are we operational? Are we tactical? Are we strategic? Where do we put ourselves? You can answer in the chat box or you can answer quietly. If but suffice to say that none of this is bad. There's none that is better than the other. Everybody is needed at every stage or dimension of business, but invariably all of us are in some form of business or the other. All right, so let me move on. So why must doctors be involved? We know where the shoe hurts. We cannot wait for government to lead the way. We know exactly what is needed for hypertensive. We know what is needed to reduce sudden cardiac death in Abuja. If NMA FCT comes together and says we are going to reduce sudden cardiac death in Abuja or sudden death in Abuja over the next 5 years, we can do it. We don't even need government to do that. So government is waiting for us to lead the way. We are waiting for government. That's just the recipe for stagnation. So how should we approach business? Internally or externally? So if you have an existing organizational platform, you're employed in a federal government facility, in a private facility, you can approach business by creating value. How else can you create value? And I'll talk about some things here. And in a new organization, like I talked about before. So look at this Ansoff matrix. This is a 2x2 table, and it's a very popular matrix for those that have been around business schools. So what is the Ansoff matrix talking about? We're looking at you can decide to create business out of your existing population, or you might go to a new population. And sometimes you can be creating value from an existing service. All you are doing is that you are improving the existing service. While in some other situations, it is that you are creating a new, totally new service. So that may be the case in terms of business. So you must choose which one is the most difficult. The most difficult is what we call the revolutionary business or revolutionary diversification, where you are bringing something to a new people and you are creating a totally new service. Okay, so the market was not there before. Take, for example, if you want to start cardiac surgery in let's say in Kogi, you are coming to a new population with a new service. That is one that is revolutionary and is typically the most difficult. While the easiest to start is to take an existing service value, improve upon it to an existing population. So you are setting up a telephone service or not a telephone service, or you are improving the way maybe using a form to collect data and to make sure that outpatient clinics in Gwagwalada is delivered in a particular way. Then you are taking an existing service to an existing population and you are doing incremental business. That is incremental, and that is typically the easiest. Now you might take what you're already doing to a new population, or you might take a new service to existing population. So those ones now may now have different levels of difficulty. Another way to look at it is to look for those that are lower cost or lower complexity, higher cost, higher complexity or delight. The ones that we consider luxury, all of these are very good. The ones we consider luxury are those that are high cost, high complexity, high device. You want to start a cath lab service, high cost, high complexity, yes, high delight, but it is extremely differentiated. And sometimes you want to do something small, disruptive innovation, like very low cost or low delight, or like Dr. Professor Oji just talked about. Just even providing amlodipine alone to village communities can dramatically change the life expectancy of those communities. That is a low cost, low complexity that has high delight. So simple things like that, or simply educating everybody that comes to your clinic about, so taking just the way they do antenatal classes. Imagine doing that in a cardiology clinic for 30 minutes before every cardiology clinic. That, for example, is blue ocean. You are taking a low cost, low complexity that has high delight and you're delivering that. So these are the ways doctors can approach business. It's not, remember we started and we said business is not about making money. It's about harnessing, fulfilling a need and doing it in a sustainable way that is preferably profitable. Okay. And then you can decide to do it slow or fast and new. And I've talked about this is called the peak chart. This is called the peak chart. And this is about knowing where you should start. If you have many ideas and you're thinking, where should you start? The best place to start is find the one that has the highest impact and that is the easiest. That is what we pick. The one that has the lowest impact, but it's very complex. So, for example, they say they want to put in 3 Tesla MRIs in all teaching hospitals in Abuja, in Nigeria. That has the lowest impact, in my opinion, and is extremely complex. Those are the ones to kill. Okay, so you want the ones that have the highest impact and are the easiest to implement, to pick. And then you begin to look at the ones, and then you next try and innovate for the ones that have high impact and are complex. Then you go to the ones that are easy. And these ones, if you have the luxury of time and money. So those are ways to approach it. I will move a little bit faster. So where do we need business in Nigeria, in healthcare, in FCT? We need it in manpower development. We need doctors that will rise up today and begin to create medical education facilities, management education facilities. These things are missing. Can you imagine that some doctors from teaching hospitals or specialists now sit down and start teaching courses on business management or clinic hospital management? And people are paying 5,000, 10,000, or whatever it is, and you just log on and you do that once a week. That is business. You are providing a service, you are doing it profitably, and you are solving a need. And you are doing so with goodwill and while making a profit. exactly fits our definition. It's not just about making money. Simulation lab for people to learn skills. There are areas of financing that is needed, more complex, insurance, corporate regulations, and then other things are very important. Now, when we come to advanced equipment, yes, there are other things, but I want to talk about some of these things that are quite important, simple, that we can easily implement as doctors. It's not everybody that you can open a hospital. There are several other areas where we can even just go into translational research and find a way to translate our research into practice. And once we are able to deliver it in an effective and sustainable way, then we are truly getting somewhere in that regard. Now we have brain drain. Maybe somebody comes up with telemedicine for brain gain. We are able to organize a way where all our people that are abroad in different sub-micro specialties are able to collaborate with those existing. We have already created a business. So these are all ways. So by the time doctors just think of business, sometimes we only think, I need to go and rent a flat and start hospital. No, not necessarily. And sometimes it's just about partnership with existing hospitals to provide the service. Okay, so this is cardio care hospital. This is our cath lab. Yes, we started this started the hospital in 2016 and started the cath lab in 2020. It's 5 years, over 2,000 plus successful cases done. That is business in healthcare. This is a NICU. We started that in 2018. When we were looking for NICU space for one of our babies, and we went around Abuja looking for space, and there was no space. And we said that this is something we could start. This is a cardiac OR lab. That's the health minister at the time in cardiac care when we were launching up that place. So those are some examples. And this is an example of Advanced Cardiovascular Symposium. This is one of the largest symposia in Nigeria where we host over 500, 600 doctors and nurses teaching about this. This is just examples and it's not always. So I will quickly run through this. I don't know what my time is like so that I will just round up in the next 10 minutes. All right, so 8 M's in terms of business, 8 M's: milieu, money, manpower, mechanisms, markets, materials, medicine, and management. I'll run through it a little bit fast, and then we just round this off. Okay, so milieu, what do you mean by milieu? You can see sometimes it's the fish that is outside and the man is the one that is struggling to swim. Milieu is everything that is around you that affects your work. So you're trying to do a business or you're trying to deliver service or deliver value to our patients, and you are looking at the milieu, the political environment, the economic environment, social environment, excuse me, the technological environment, and all of these things play a very important role in our delivery of services. Okay, it's a little bit bigger than this, but this must be factored in. So if you don't consider all of this and you decide, for example, to start a cardiac surgery service or a bone marrow transplant service, and you do not consider all of this, you may not be successful in creating sustainable value. You may succeed for one or two patients, write one or two papers, but that may be all because you do not consider the political, economic, social, technological space. Okay, you have to now talk about money. Money is very, very important. The people that don't like to talk about money are the people that are typically the most money hungry people. But money is very important. And if you see this picture I got from the internet, the money is even weighing down the drugs because all the people who want to help, sometimes they don't have money. We've had to put in 4 stents for someone that didn't have money because he came in with a heart attack and he didn't have money for his stent and he had a cardiac arrest in front of us. We resuscitated him immediately, did his angio. He had 4 blockages. He had another cardiac arrest. We resuscitated him, he came back. And whether he had money or not, we had to humanitarianly put 4 stents. For those that know how much stents costs, as in buying them from US and bringing them here, you know that is a huge ask. Yes, the man signed the undertaking that he will pay later. I don't think we ever saw him again. But he's alive somewhere by the grace of God. So money is definitely the determinant in what we can do as doctors. And I'll talk about money a little bit, and then the rest I will move a little bit slower. We know that even now we are saying there's no money, there's no money. People are still spending upwards of $2 to $6 billion on urban medical terrorism, including here Nigerians. Unfortunately, it's a very small amount of people that are spending this amount of money. And most of the money is spent in 4 critical areas. This is from data. I think most of this data is from McKinsey et al. So 60% in cardiology, nephrology, orthopedics, and oncology spent around this. You can see these are high infrastructure areas. But it is less than 0.5 to 1% of people that are actually getting it and going abroad. So the ones that are available in the country to be able to give this service is a very important thing. Now, money is a three-legged stool. People always think of money as cash. Far be it from it. A lot of times, a lot of us don't have cash at all, but does not mean you don't have money. Money is a three-legged stool. If you forget every other thing, remember this about money. Money is a three-legged stool, and the way we measure money in business involves three key instruments. The first instrument we use to measure money is called a balance sheet, and that measures assets. Assets does not just mean buildings, it also means cash, financial instruments, buildings, infrastructure, equipment. And it also means things that you have borrowed. So when we talk about balance sheet and assets, we're talking about a balance between the money you are owing and the money that is owed you and the money that is your own. You put all that together, that gives you your net assets. That is how you measure money. The second way you measure money, which one we use, is profit. And profit means that, and you'll find out that profit is even in the Bible for the Christians. Profit means that somebody is benefiting from a service. They are benefiting so much that they are giving you money, and that money is above what you have spent on it. Now, this profit may not be the same as cash. You may be making profit and not have cash, and you may have cash and not be making profit. Now, if you are in paid employment, you must make sure that you are not just collecting cash in terms of salary, but that you're actually providing profit, which means that you are reasonably and valuably providing enough service above your costs. There must be people and evidence that there is benefit from your employment, and that is profit. So when we are calculating money or looking at money, we look at all of these three things. All of them are extremely important. No one is more important than the other, but I'll explain a little bit why one, depending on the time frame you are looking for. Okay, so you must never look at cash only, not only the amount of money people have. Some people make all the mistake and try and get cash. So even if we look at the example of people that win lotteries, people that win lotteries are those that get cash without making profit. They did not offer any service, yet they get cash because they have no profit and they have no assets. Invariably it takes just a matter of time before the real level of their money shows up. So it is unsurprising that over 95, almost 98% of those that win massive lotteries end up broke within 5 to 10 years. In fact, even worse off than when they started. So it's simply because they got only cash and they did not get money. Money involves all three services. And so very important to know that profit is not cash and cash is not profit. So you can have a lot of money and you're not making profit. You can make a lot of profit and not have cash. However, if you make profit without cash, if you don't have cash today, you will be bankrupt immediately. And if you have cash without profits, you will be bankrupt eventually, just like those that are winning lotteries. And so the prayer really is not give me money, is that people are benefiting so much. Like we said, business is not about making money. It could be about making profit, but not about making money. Okay, so why do we need to profit? Profits ensure long-term sustainability of the organization of the service. Initial investment and capital needs to be recovered, and that is through profits. Profit is important to pay to staff, to employees, to managers, increasing their commitment. And if you're not making profits, you cannot reward doctors. So when we look at and we say doctors should get better salaries and all of that, I agree. But doctors should also look at how much of service are we giving? Are we coming to work once a week? Are we coming to work and spending 2 hours in the hospital and leaving? Are we really generating? How many patients are we seeing per month if we're to quantify it? Profit is also the basis of self-sufficient growth. Profit is godly. Lack of profit means that our cycle is broken and operations will not continue. So failure to grow means you'll be eaten up. Recruiting and retaining the best staff can only happen when you are growing and that profit is needed. Profit is through profits that we generate taxes for the nation. And to interest some of us that don't know, to know that 30% of all profits made by organizations are paid back as taxes to the government. That is quite significant. And so the government takes 30% of all profit made and is supposed to use that to benefit others. So you must be able to move from or be able to see where you are and make sure that even though you are an employee at a time, you should be able to think like an owner and think about all the other things. So I'll move fast. Patients may pay directly to the hospital or doctor. Sometimes they have an intermediary. But nowadays, we are talking about two intermediaries between the hospital and even sometimes before the doctor even comes in. So while doctors are focused on healthcare, we've forgotten these two intermediaries. While we are arguing over who should be head of the hospital, people are coming, are not even doctors that are owning and running these two intermediaries. And these two intermediaries are eventually determining what is covered and what is not. It will interest you to know that even right now, you cannot, if you are under most insurance companies, you cannot get the world-class standard care for a heart attack. You cannot get a pacemaker, not even under the NHIS. And so that's quite important for us to know. And at one point, the healthcare provider, the doctor, is dealing with market forces, struggling to help the patients. We were trying to do more. But the people that are creating the policy and are closer to the money, while we are closer to the patients, they are not seeing the patients. They are looking at other things. And so we as NMA must make sure that we are part of this process. You will see the economic pressure coming from the people to us as doctors and less likely to the people that are at the very top determining the policy. So we must make sure that we balance and we find ourselves somewhere in between. Of course, the third part of business is manpower, and I'm going to be wrapping up shortly. I think my time should be running out in the next 8 minutes. Okay, so manpower and human resources. And one of the things that we must avoid in running a business or running a service is employed but disengaged staff. People that say, is it my father's business? And really don't care, just trying to pass through, just trying to make sure they don't get into trouble. That is normally the bane and when designing management processes, you want to make sure that you design it better than that. We can see that our healthcare system is grossly underpowered, but it's even worsening by the day. And you see that there are four reasons people work. And when you are getting people for a business or practice, you must be able to harness and manage those that are coming for a survival or for living. Those that are just coming for status, they want to be in this kind of hospital. Those that want to have autonomy to do what they want, and those that want to serve others and leave a legacy. And you need to adopt them. This book by Brad Adams, I think, Ownership Thinking, talks about people that have the right values and those that have very high performance. Those with very high performance but are low on values are called terrorists. Those with high values and high on performance are called stars. And we need to try and get more stars working with us, working around us. And PURE means previously unidentified recruitment errors. They are performing very poorly and they are very low on values. So this was taken from there. Then, of course, mechanism, you need to manage delays, you need to manage mistakes, you need to make sure that everything is going according to process, make sure that costs are not unnecessarily high, and you need to manage data. And that's the mechanism of delivering business. It's important to know that you don't know what you don't know. You can't do what you don't know. You won't know until you measure. So we say in God we trust, all else is data. So if you want to deliver a good business, you must get data. You don't measure what you don't value. So you have to get data, you have to measure it. And you don't value what you don't measure. If you don't value it enough to measure it, why should anybody else value it? And so you need to measure, you need to get data. What is your satisfaction like? What are patient satisfaction like for patients on your ward? And how can you improve that? That is a way of improving business. Then we talk about markets and marketing. And important to know that marketing is quite different from advertising, because it also involves creating a way that value is delivered. And even though there are 7 areas, it is quite important to know that it's not just about promotion, which is advertising. It's also about making sure the service is great, the price is right, the place is good, the process of delivering the care is nice, and the people delivering the care are doing so well, and there's evidence for the person to go home with. This is quite important in delivering service. And of course, number 6, materials. You can know all you want, you can be a specialist in all the areas. If you don't have the right equipment, it might be difficult for you to deliver good and high-end business. It is said, according to McKinsey and International Finance Corporation reports, that in Nigeria, half of modern diagnostics are in the private for-profit sector, and virtually all functional cath labs are in the private sector. Almost electronic medical record is mostly domiciled, and I think less than 5% of publicly run hospitals have been able to successfully implement electronic medical record. This is data as of 2021. It may have changed by now. Scattered and fragmented use. And these materials, infrastructure, and technology is very important in delivering. This is some equipment in one of our centers for pacemakers. And quality, business quality, medicine quality. Like we said, it's not about making money, it's about delivering value. And one of that quality is safe. It must be timely, it must be effective, efficient, equitable, and patient-centered. So no matter what we are doing, we must make sure it's quality. We must be able to balance evidence-based care with whatever financing mechanism and with the entire system, which is the rope of how we deliver, the milieu of how we deliver our services. And finally, number 8 is management. And can anybody in the chat box, can we say which one we think is better? The one on top or the one under? Which one do we think is better? Which one do we think is better? Can we put in the chat box if you have not slept? Can we put in the chat box? Which one do we think is better? The one on top or the one under? Yes. Yes, somebody said
The one under.
Somebody said the one under. Somebody said blue, the one under. Blue, under. Oh, fantastic. Bottom. Okay, so I will tell you that neither of them is better. It depends. It depends. So this is one of the things that people put on social media and say the one under is the best. But no, that's not correct. If you as the leader are under, you will not be able to see where to go. You will not be able to see which direction. And one day you raise up your head and find out that you're in the wrong place. You should at some times be on top and at some times be down. But never should you stick in one place at a time. There are times, for example, 2023 came and suddenly everything changed. Dollar went 3 times up. Prices of pacemakers, stents all tripled. If the medical doctor, medical director is only here still operating on patients, one day he will come up and he will not be able to pay his salaries. So you must make sure that at some point in time, you can see the big picture. That is what we call strategic. And here we call tactical or operational. And you must be able to rotate in between. So the correct answer is it depends on the situation. And you should be able to rotate between two. None is better than the other in reality. Okay, so we are able to put in a right mix of all of those 8 M's, and that gives us what we call strategy. So in conclusion, becoming entrepreneurial and, understanding money and finances and business particularly is very important to solutions in our healthcare populace. And Nigeria is waiting for us to deliver solutions. The doctors are leaving, but some of us are staying behind. And I think that we can become all we are supposed to be, and we can actually make Abuja healthcare, Nigerian healthcare, a lot better. Thank you very much for having me.
Thank you very much, Dr. Iseko. He's a consultant physician, interventional cardiologist. He's the group medical director of Lemi Hospitals. He's a renowned businessman. Thank you for that presentation. You have pointed out the aspects we need to know and talked about delivering value, business quality, and also maintaining evidence-based medicine. Thank you very much. And thank you for keeping to time. We'll take questions now. I guess we have questions to ask.